So welcome everyone on YouTube, Periscope, as well as Facebook. Today we're going to be giving a talk, as I just shared with people on Instagram, on the power of black cumin seeds. It's a nutrient that we've been researching for a long time. It's widely used, all throughout, typical Asian cultures. In India, we use it as an oil for many other things in food. But I want to share its very powerful properties today, particularly for antiviral, antibacterial, and anti-inflammatory. Many of you know that I'm running for United States Senate, and I always like to share with everyone what's going on with the campaign, what we're up to date. So let me just hop right onto that. So today I have to leave literally in about 20 minutes, so I'm going to try to go through this pretty quickly. I'm going up to the northern part of Massachusetts, Methuen, Haverhill, and Lawrence. We take the bus out there and we give talks. Our campaign, as everyone knows, is about three fundamental things which are interconnected: truth, freedom, and health. Health is what we're talking about today, the power of building immunity through black cumin seed. But we can't get to really the truth about health unless we're able to do science, real science. What we see happening in the world right now is that we have academia, the universities, the large institutions have essentially become corrupt, where you have fake science. And the reason that's occurred in the quest for truth is because we've quelled freedom. We've suppressed dissent. We've suppressed debate on these issues. So people are moving away from the scientific method to scientific consensus. So we need truth, freedom, and health. And with health, we're strong enough to fight for freedom. So that's the basis of our campaign. All of you out there, wherever you are, if you can tell everyone you know that September 1st, which is coming up very soon, less than 30 days, less than 30 days, is the important date for the Republican primary, which I'm running in. So tell all your friends to vote for Dr. Shiva for Senate September 1st in the Republican primary. So make sure you do that. And as a part of this, our opposition is raising millions of dollars, and we've raised close to around $1.5 million bottoms up. I've put my own money and all of you have donated, but please go to, if you click on the donate button, you can donate to the campaign. We need to raise about 2 million more. They're going to raise probably 10 million, but we only need 1/10 of what they do, or 1/5 of what they do, because we know how to stretch the dollar better than them. These people are lawyers. They just take your money. But when you donate to our campaign, 25 or more, everyone gets a copy of the book, the ebook, System and Revolution, where I teach you what all systems are, the principles of all systems. It's a distillation of knowledge from nearly 40 years of my quest for understanding systems. And then I give you a tool called Your Body, Your System, which helps you understand your body as a system, how your system works, and how to bring it back into alignment for you. And by the way, if only people who are US residents can donate to a federal campaign. And some of you have asked, hey, Dr. Shiva, I really want to get access to the book and the tool. You're outside of the US. Well, you can go directly if you want. This is as a reference to Your Body, Your System. And you can click on the Get Started Now and get it. But one of the cool things about this tool is once you understand the principles of all systems, and three of the most important elements of all systems are the forces of transport, which is movement, denoted by the T on this triangle here; conversion, the elements of converting one form to another, like digestion, or your CPU, the central processing unit; and storage, like your USB drive stores memory, as well as your body stores memory. And that's storage. So transport, conversion, and storage. And when you use this tool, you answer a set of questions and you can figure out what kind of system you are, denoted by that red dot. Then you can then figure out how your system is deviated from itself by answering a different set of questions. And this is all unique to you. That's a black dot. And then you can find out from a systems perspective, you can learn how to use this to bring your system back into alignment. That's through the inputs of food, supplements, as well as exercises. So that's what systems are about. You figure out where the systems likes to operate, where it deviates, and how you bring it back into alignment. So please take advantage of that. As I mentioned, any other resources, you can go to Shiva for Senate and let all your friends know that September 1st is a very, very important date. So I'm going to hop right into the talk about black cumin seeds. Now, black cumin seeds are a spectacular nutrient. And typically in India it comes as a seed, but today you can get it from some very good companies. Make sure it's organic, in an oil form, and that you can add to your smoothies. You can take a teaspoon of it. I typically keep it stored in their refrigerator or their fridge to preserve the antioxidant properties, but that's up to you. That's what I recommend. So let's sort of jump right into this and go into what the properties of black cumin seed. One of the things I want to mention is that any of you want to know, what I've been up to and what I do. I separate from running for Senate. I run I've done many things. If you go to VA, Victor Alpha Shiva, vashiva.com, that's my blog. It's my personal blog, but you can see the history, the fact that I created the first email system when I was a 14-year-old kid, long before I came to MIT. And then you can also go into more details understanding about the Senate campaign. But one of the things that I'm most recently working on is a very cool technology that I created out of my PhD work called CytoSolve. CytoSolve allows us to eliminate the need for animal testing, use the computer to mathematically model functions, chemical reactions in the body, so you can use that to really identify what works and what doesn't. Even like the world of pharmaceuticals, for example, takes 13 to 15 years to create one drug, $5 billion. And the stuff that comes out of that, they have to do, first of all, in vitro testing, animal testing, then they do phase 1, phase 2, phase 3 human trials. And it takes them a lot of time and money to do that. And the drug that comes out of there, it only works for 10% of the people, okay? And that means that when there are side effects, you can sue these companies. So what's happening is, if you look at this graph here, year over year, they're spending lots of money on R&D, and even the FDA is not approving as many drugs because of their toxicity and their failures. So pharmaceutical companies are actually failing. That's why the big move to get all of us vaccinated, because it's follow the money. Vaccines have really very little regulations. You cannot sue the vaccine companies. And these are the two most important things that allow, that's why we're seeing all this fear mongering. So one of the things that, as I've shared before, starting in 2003, one of the important developments that took place in biology was a revolution where we found out that we only have 20,000 genes, as you're seeing in this graph. 1993, we thought we had about 100,000 genes. By 2003, it turns out we have the same number of genes as a small worm, about 20,000 genes. So that flipped biology on its head. People realized, well, if we want to understand the whole, it's not just the genes. Prior to 2003, the religion in biology was that if you have this gene, you're going to get this disease. Well, that changed. Genes can be turned on and off, which means food, what you do, your thoughts can turn on and turn off genes, the actions, the environment. So what you see in this chart here done by Peter Hunter is that Peter proposed, in order to understand the whole body, it's not just the genes, it's the genes, the proteins, and all the interconnections. So in 2003, I was running a very successful company. I took time off because of my love of biology and computing, and I came back to MIT. And the challenge was, could you mathematically model the entire human cell, where you look at the human cell, as you're seeing in this picture, as a big interaction of many, many different chemical reactions. So imagine if we could actually mathematically look at every little piece of a chemical reaction, convert it to mathematical models, and then interconnect them all. And that became the basis of my PhD work. And I created another technology called CytoSolve. And CytoSolve today is helping companies really figure out what combinations of compounds actually work. So it's very valuable for natural products, which have thousands or hundreds of different natural compounds. So we've published papers on this, but we have the ability to take all the literature in a field. Today we're going to look at cumin seeds and its effect on immune health, distill it, extract out the molecular mechanisms, and actually get down, based on the known science, to understand it. So in a simple way, if you think about how we build airplanes, we don't just throw a pilot in and say, oh my God, hope it works, right? We don't just put it into, we don't build planes in a wind tunnel right away. We do everything on the computer. We figure out all the different problems, and that before we go waste time and money. And that's what CytoSolve allows us to do. We can use the computer to understand molecular interaction. So here's a fun example. So consider in the old days, still in villages, people will mix different types of things in a mortar and pestle to figure out what's right for you. So for example, the studies on curcumin, which is the active ingredient in turmeric, which is a herb, shows, and this is what we've done, we've looked at all the places that curcumin connects at the molecular level, and this was distilling 6,000 papers, to essentially support your, it's an anti-inflammatory. So you can see curcumin hits, the red line denotes all the pathways that it hits. The circle, the big circle is your cell wall. The inner circle is your nuclear wall. So this is from distilling it using CytoSolve. Similarly, we did it for resveratrol. So this is an example. Imagine if you're having a curry meal and you're drinking some wine. You can see what happens when both of these compounds interact at the molecular level, long before we kill animals or hurt animals. So here we can see on the far right column, if you look at the fourth column here, that column is really the column that's looking at a molecule which is indicative of high inflammation or inflammation in your body. So what you can see here is that value keeps going down based on how you do combination. So for example, first, no curcumin, no resveratrol, we have high inflammation, 0.15. Then I just give curcumin 5 units, you notice, and it drops down to 0.05. Just give resveratrol, drops down from 0.15 to 0.06. But look what happens when I do a combination. Even though it's 40% less curcumin, 60% less resveratrol. By the way, resveratrol is the skin of red grapes. That's where it's found. And curcumin is the stuff in turmeric. But you can see it drops by another 200%. This is why foods are so powerful. So let's go on to black cumin seed. So black cumin seed, you can buy it in the store. You can get it as an oil. You can make it into a powder. But I think this is one of the most underappreciated nutrients for antiviral, antibacterial. So let's really look at this. It looks like this. It's quite black. That's why they call it black cumin seed. It's native to the Middle East and Southeast Asia, and it's used in treating various types of human ailments. I mean, it has the research we've done, I could probably do 5-10 videos on it, but the medicinal benefits are attributed to the seeds and the seed oil. Now, black cumin seed has about 62 different compounds, fatty acids, minerals, polyphenols, phytosterols, as well as vitamins, okay? As you can see here. And the minerals in about 100 milliliters of cumin seed oil, and by the way, you can buy black cumin seed oil, you can order it. Check this out, look at this, 1,500 milligrams of calcium and 1,200 milligrams of magnesium. People want to take those calcium magnesium supplements. Look at what it has in 100 milliliters. Potassium, 7,700 milligrams. Phosphorus, very good for the brain, 4,505 milligrams. Quite extraordinary in terms of its mineral content. Whenever you see stuff that's black, it has a lot of minerals, and that's what you're seeing here. Now, the vitamins in that 100 milliliters, a lot of vitamin C, 0.77 milligrams, and vitamin E, 0.62 milligrams. So what are the active compounds? Remember, herbs are not just a single compound, okay? That's one of the things we need to understand. Drugs, when you think about a drug is basically a single molecular compound. And by the way, drugs are synthetic. They don't even occur in nature. Our bodies never even sense them, but foods, our body has receptors. It senses them over all of our evolution. So if you look here, the compounds in black, the 7 most important compounds that have medicinal benefits that we've identified so far are thymoquinone. Awesome. Thymoquinone, you can study about it. Nigellone, let me just bring this up so I can read a little better. Nigellone, P-cymene, carvacrol, alpha-thujine, thymol, which you'll see come up in a lot of different areas, and alpha-pinene. And you can see the chemical structures here, they're quite different. You notice very organic chemistry, if you ever study, it's a beautiful field of science, but you can see these are very, very different kinds of compounds. And these are the ones that carry the very powerful medicinal benefits. But there's 7 active compounds. Now, one of the things that's really important to remember is I'm only talking about the immune health in this video, but black cumin seed has extraordinary capabilities in a bunch of other areas. It's a power for anti-cancer, anti-inflammatory, anti-diabetic. Sorry, I said anti-diabetics twice. Immunomodulator, antiviral, antibacterial, and it's an analgesic. So this is quite an extraordinary nutrient, quite extraordinary. So let me go back here, and let's now get down to really looking at the immune system. As everyone knows, I always like to educate people on what is the immune system. The version of the immune system that is currently used to tell everyone that we should all get forced vaccinated, everyone should get the same number of vaccines, is based on a 50 to 100-year-old model of the immune system. And this is their model. And their model is you have the innate two-box model. You have the innate immune system, which is a part of the immune system that's in your eyes, your nose, your ear, your skin, all that part of your immune system that faces the outside world. So when a pathogen first comes, there's cells in this part of your immune system which try to take it out. It's like the Marines. They try to take out they try to just start shooting everywhere, regardless of the pathogen. They're non-specific. That's the difference. Then you have in the adaptive immune system, which is like Navy sharpshooters or a Navy SEAL sharpshooter, which tries to take out that particular pathogen by creating an antibody, particularly for viruses. So this is the old model of the immune system, still used to say, hey, we want to create antibodies. Let's inject you with a vaccine. Voila, you get antibodies. You should be okay. But the reality is this is based on the invited distinguished lecture I was asked to deliver at the National Science Foundation in November of last year, where I shared a much more comprehensive, the modern view of the immune system. It's not just these two boxes. It's much more profound. It also includes the interferon system, which is a system that I researched quite extensively for my PhD work. The interferon system is a system that's a missing link between the innate and the adaptive. And the interferon system is really a powerful system that when you get exposed to a virus, interferons get created separate from antibodies. And no one wants to talk about this. Everything's antibodies, vaccines, but your body creates interferons, not only for that virus, but for many other viruses. Thousands of them get created, thousands of genes get, upregulated. So the interferon system is a very powerful system. Fauci and these people will never talk about that. Then we also have the gut microbiome, nearly 60 trillion bacteria in your gut and other parts of your mucous membranes. And then we have the virome. We have about 380 trillion viruses. And that entire system from the gut is connected to your brain, to the gut-brain axis and your neural system, okay? So the immune system is far more complex. This is why not one size will fit all. This is why when I created Your Body, Your System, it helps you identify what kind of body you are and what are the right things for you. Now, when it comes to immune health, black cumin seed does a couple of very important things. It modulates the immune response via anti-inflammatory mechanisms. Look, the virus and the pathogen is not what kills you. This is what the stupid people on TV never want to talk about, or the fake scientists. What kills people, what hurts people, is an overreactive immune system. The immune system doesn't have shock absorbers. It rattles like crazy and it attacks your own tissues, okay? So if you can control the inflammation process and it modulate it, then you can have proper immune response. And that is why the goal here is not to eliminate inflammation, not to have overinflammation, but to modulate it. And that's why food and medicines are so important. So in the case of black cumin seed oil, it works by modulating the immune system through anti-inflammatory mechanisms. Separate from that, black cumin seeds are also antiviral. They take out viruses, okay? And they take out bacteria. And the bacteria do not also develop a resistance. This is very important, unlike vaccines and antibiotics, which the bacteria can, in the case of antibiotics, bacteria can develop resistance. Guess what? They don't develop resistance to black cumin seed, okay? So let's go into some details here. I like to explain the biology or the biochemistry so you appreciate this. Again, I'll walk through it slowly. But one of the important things is this very powerful molecule in black cumin seed called thymoquinone. So when you buy black cumin seed oil, it'll tell you what percentage of thymoquinone that has been extracted for. So we all know that inflammation, overinflammation, leads to disproportionate immune response, which means your body starts attacking itself through what's called the cytokine storm or overinflammation. Now, there is a very powerful molecule in your body called NF-kappa beta. That molecule is involved in promoting the expression of two inflammatory enzymes, COX-2 and 5-LOX, 5-LOX. Now, when you have that in your body is undergoing inflammation, and NF-kappa beta creates that. Now, it does it in a normal mode, but if it overdoes it, like in the case of cancer, so NF-kappa beta is involved in cancer, you have a lot of that. and your body creates way too much COX-2 and 5 LOX. So what thymoquinone does, this red bar here with the hammer-like thing, it stops that transcription factor. So black cumin seed oil compound thymoquinone inhibits NF-kappa beta, thereby inhibiting the expression of COX-2, which leads to this chemical called PGE2, which causes inflammation, and 5 LOX, which creates what are called leukotrienes, which create inflammation. Okay, so that's how thymoquinone works. So it modulates the inflammatory process by blocking NF-kappa beta, so it doesn't produce these other two enzymes which create these inflammatory markers. So I hope that's clear. Thymoquinone, black cumin seed, so you can impress your friends by telling them you heard about thymoquinone with Dr. Shiva. Next thing, so that's modulating the inflammatory process. So remember, there's two things that are going on here. Black cumin seed oil modulates, the inflammatory process, like putting shock absorbers, good shock absorbers on your car, good shock absorbers on your immune system or your inflammatory process. But the other thing that it does, it actually knocks out viruses. This is quite amazing, and it also knocks out bacteria. So let me walk you through how it does that. So what you're seeing here is that the way black cumin seed oil does that is black cumin seed oil increases the production of IFN gamma, which is part of the interferon system, okay? And IFN gamma is like a nuclear weapon, okay? IFN gamma higher IFN gamma increases the production of innate immune cells, macrophages, as well as cytotoxic T cells, okay? These are very powerful because it's supporting the increase of macrophages, which go out and knock out viruses, and it also increases cytotoxic T cells. Now, the macrophages and the cytotoxic T cells directly kill the virus and mitigate infection. And this is effective. It's been shown from the current research to be effective against hepatitis C virus, as well as murine megalovirus, okay? CMV. So very, very powerful. So it directly kills the virus, okay? Because it upregulates IFN gamma, interferon gamma, which is part of that interferon system, which results in you get more macrophages and more cytotoxic T cells, which go and annihilate that virus. So think about this, that we have a natural compound in black cumin seed oil, which increases the production of more interferons, okay? Which is that part of the missing immune system, which is CDC doesn't really highlight. Everything for them is about vaccines. And by the way, I'm not anti-vax or pro-vax. My issue is we need to boost immunity. Why the overemphasis on vaccination versus boosting our natural immunity? And furthermore, not everyone should get the same medicine. So let's go back here. And then the other important property is the antibacterial activity of thymoquinone. Look, bacteria hide in what's called biofilm, okay? They literally hide within this biofilm. So exposed bacteria can be killed if you take away that biofilm. The reason a lot of medicines don't work is because you're not breaking through the biofilm. Even in the world of drugs, when people give antibiotics, some of these antibiotics don't work because the bacteria hide in this biofilm. So thymoquinone, same thing, that other chemical, also has antibacterial properties because it's shown to have a broad spectrum of antibacterial activity. And the way thymoquinone works, it exerts its antibacterial effect through the inhibition of biofilm formation. So there are certain diets, for example, if you eat a lot of carbohydrate diets, right, or refined carbohydrates, your body builds more of these biofilms. Bacteria can hide in there. Now, the biofilm is a community of bacteria attached to what's called a biotic surface that allows them to survive in hostile environment conditions. So basically, bacteria create almost like their own mound, their own wall to protect themselves. And the inhibition of that biofilm by thymoquinone kills the exposed bacteria effectively. Okay, so that's what's so powerful here. So what we're looking at is not only does black cumin seed oil, you can use it to directly kill viruses because you can upregulate IFN gamma, but you're also using it because of the thymoquinone as a way to destroy the biofilm in which the bacteria hide. All right. So I hope that's clear. So that's how it works. Now, when you look at thymoquinone, it effectively has been shown to kill several types of bacteria, staph, right, listeria, as well as periodontal disease, what's called the bacteria that causes gingivitis. And most importantly, the thymoquinone, the bacteria cannot form a resistance. Okay, antibiotics, your body can form a resistance. That's why, or the bacteria can form a resistance, but with thymoquinone they can't. So how much should you take? Many of you will write to me and say, Dr. Shiva, how much should I take? And again, I'm not here to prescribe you anything. That's not what this is. This is basically distilled down information, and everything I'm sharing comes from the literature, comes from thousands of scientific papers, and I've been fortunate because of CytoSolve, we can distill it. But one of the cool things is from how much should you take? Well, about 200, maintenance dose around 250 to about 1,000 milligrams. It's about 1 gram black cumin seed oil. That's about a teaspoon to 2 teaspoons. For inflammation, if people are suffering from serious rheumatoid arthritis, Gata et al. In 2012 has found that about 1 gram per day black cumin seed oil can support that. That's on the higher end of the maintenance dose. For anti-diabetic use, right, about 1 to 3 grams of seed per day. People can, use a mortar and pestle and break it up. And for immune boosting activity, where let's say people are under serious immune attack, right, you're looking about 2.4 grams to 4.8 grams per day. And in summary, one of the important things is to remember is this, everything I'm sharing with you has been researched, nearly 2,900 plus research articles, 72 clinical trials, and it's been studied for over 55 years. 55 years. And by the way, if you taste it, the oil, it has a very interesting flavor. You can add it. I typically put it in. I had a morning smoothie today. I put some avocados, apple, chlorella, and then I put a little teaspoon in there. You can take it straight, but enjoy it. It's an amazing food. Now, relative to the engineering systems approach, everything I've shared with you is looking at it from a systems biology standpoint. What I can also share with you, as many of you know, the Your Body, Your System tool, which everyone should take an opportunity to get. People who support our campaign, if you're in the US, can take advantage of it. What's it? Okay, I have to wrap it up, guys. I have to get on the road soon. But if you look at it here, let me just stop this here. Remember, I shared with you earlier that if you go to Your Body, Your System, this tool lets you figure out how different foods and supplements affect you. So if that red dot represents who you are, and the black dot represents how you've deviated from you, let me make this a little bit bigger. What you can do with foods is almost bring that black dot back to you, because foods also have properties of transport, conversion, and storage. Food has forces. You can understand it from an engineering system standpoint, or you can understand it from traditional systems of medicine. And for my Fulbright work, I integrated this. And those of you who are very interested in learning more about this, you can go to systemshealth.com. I created a whole educational institute. People have asked me to share what is Systems Health, but I have a whole educational institute where you can actually take courses, you can get certified. There are all these amazing courses. There's a master certification program where you can understand all different nutrients, but you can actually learn a systems approach, an engineering systems approach that integrates Eastern and Western medicine. But let me bring this back here. But if I go back to the graph here, what you notice here is black cumin seed oil, it stabilizes transport. So if you're feeling all sorts of jittery or feeling really, really hyper, black cumin seed oil, that's a transport. It reduces motion. It increases transport, which is over here, you see, which is digestion. So it supports digestion and conversion, burning up fat. And it stabilizes kapha in the Indian system, or storage. So, balancing weight gain. So from the Eastern approach, you can see it also has some very, very similar uses that's coming at it from a different angle. And that's what the Your Body, Your System reveals. And finally, in closing, I'm sorry I have to rush this a little bit, but here are the 4 takeaways. Black cumin seed oil inhibits inflammation, by literally suppressing those enzymes, COX-2 and 5 locks, to modulate the immune response. Second, black cumin seed, by upregulating the interferon gamma, knocks out viruses. Very, very powerful. And then the third thing is black cumin seed inhibits bacteria by going after and stopping the creation of those biofilms where bacteria hide underneath. And the fourth thing is bacteria cannot develop resistance to black cumin seed because of that active compound, thymoquinone. So there you go. So that's the talk today on black cumin seed. It's out there. For those of you on Instagram, you can't see the slides, but you can go get it on YouTube, or you can go get it on Periscope, or you can get it also on Facebook. In the interest of time, I'll look at, I'm just going to quickly scan what questions people have. Let's see. Yeah, look, this is a very powerful compound, right? So you have to be careful how much you take of it, right? So study it. I mean, research it. Black cumin seed, yep, it is a seed. Great. Okay, so in closing, everyone remember that we have about less than, today's what, August 2nd? We have less than 30 days to the Republican primary. I have to go to 3 towns today that I'm taking the bus and taking to meet volunteers and people. Let everyone let them know that they need to vote September 1st. Wherever you are in the world, take advantage of your body, your system, get System and Revolution. Tell every one of your friends to vote on March 1st in the Republican primary. And those of you in the United States, support the campaign. We spend every dollar very, very, tight. We're very frugal, but we do want to start taking out some TV ads to win this election. We need to be able to do that. It's a little bit expensive. So whatever you can contribute would be great. Anyway, thank you, everyone. Be well, be the light. Let's keep up the fight. Let's win this. Thank you.